everyone. Thank you for joining us this evening for our book club. I'm so happy that you're all here. So in case we haven't met before, my name is Emma and I'm from the Yinova Center. Before we dive into our discussion with Jill, the author of Making Babies and Yinova's founder, in case you're new to our community, or Jill, I wanted to let you know a bit more about our center, as well as tell you a bit more about Jill Blakeway. So the Yinova Center is an acupuncture and Chinese medicine clinic based in New York City. We specialize in fertility and reproductive care. As of recently, we've moved part of our practice online and been offering virtual consultations to support our patients, but we've reopened our clinical doors and are available for in-clinic acupuncture as well. Dr. Jill Blakeway is an acupuncturist, herbalist, and the founder of the Yinova Center, where she's been treating patients for over 2 decades. Jill has always been passionate about helping people achieve a healthy pregnancy, so much so that the New York Times has described her as a fertility goddess and named her as one of Manhattan's top acupuncturists. She credits much of her success to combining the ancient wisdom of Chinese medicine with modern conventional biomedicine. To that end, she joined forces with a reproductive endocrinologist to co-author the best-selling book, Making Babies, a proven 3-month program for maximum fertility about how to conceive naturally, which we're going to talk about more today. She's also authored 2 other books on health and healing, Sex Again, and Energy Medicine, The Science and Mystery of Healing. Many of you submitted questions beforehand, which we're really looking forward to diving into. If you have questions throughout this, just please pop them in the chat box or the Q&A and I can read them out loud for you. And with that, I'm gonna let Jill get started and tell us a bit more about Making Babies.
Oh, thank you, Emma, for that lovely introduction. And thank you, everybody, for coming tonight. I would like to only talk very briefly, actually, because I'd like to spend a lot of time answering questions. Last time I did a book club about Making Babies, which I guess was about a year ago, because time has flown. I realized that people just have lots of questions, and this is a really good opportunity to ask them. And I don't know the answer to everything, obviously, but I have spent a couple of decades doing this and I've seen a lot. So I'm really happy to give you opinions about things. So Making Babies, as Emma said, I wrote with a reproductive endocrinologist, Dr. Sammy David, and he was actually the first person to ever do an IVF in New York State. And I just mentioned that because we got a bit of a reputation for being anti-IVF, which of course we are not. But one of the things we wanted to write about, and one of the reasons that we were sort of prompted to write this book was we felt that it was sometimes overused as a technology, that if you have a hammer, everything looks like a nail, and that in fact, with a bit of diagnosis, a lot of people's fertility problems were actually solvable without using assisted reproductive techniques. And so we wrote the book, and those of you who've read it will know, we divided people up into 5 buckets. And that was because between us, we realized there isn't a one-size-fits-all solution to fertility problems, because there isn't, the reasons that couples aren't getting pregnant are very varied. But there are sort of 5 major types of issues we see, and we realized we wanted to give very different advice to all of them. So we divided into types, and I'm going to go over them briefly, and maybe you'll be able to recognize yourself though. The first type we called the tired type. These are people who are spleen qi and kidney yang deficient in Chinese medicine. And what they really are people who are very sensitive to sugar, have a little bit of insulin resistance sometimes, or a sort of a cravey relationship with sugar, people who are tired, who put on weight easily, who run cold, who have circulatory issues, that kind of thing. And we wanted to give them advice that was about warming and activating and dealing with sort of the hormonal effects of insulin resistance, really. And then the next type was quite different. This was, we called them the dry type. And these were all the people, often people who are menopausal, but not always, and not, by menopausal, I don't mean in menopause where it's hard to get pregnant, obviously, but just people who are sort of perimenopausal or on the edge of menopause. And we have lots of patients like that who do go on to get pregnant, actually. And so we wanted to, these people getting drier. They're suffering from vaginal dryness, dry skin. They often feel fidgety and agitated. They have hot flashes or night sweats. And obviously we wanted to give them the kind of advice that would help them nourish their own estrogen, support their bodies to produce enough estrogen. And they're slightly different to the type that we call the pale type. These are people who often don't get their period. They often have hypothalamic amenorrhea, but some of them get their period, but they have irregular cycles and they're just a bit undernourished. They're often a little bit thin or a little bit over exercisey. And so we wanted to, in Chinese medicine, that's called blood deficiency. And what we wanted to do is give them information about nourishing their blood. And then we have the stuck type. And these are all the different ways that estrogen dominance can manifest. And by estrogen dominance, I mean when you have lower progesterone in the luteal phase. And so the feedback system becomes a little bit corrupted between estrogen and progesterone, and there's a little too much estrogen. And what we wanted to do was teach people how to look after their livers, because your liver, one of its lesser functions, and therefore one of the first to go if it's a bit overtaxed, is that it takes up and processes excess estrogen. And so these people have PMS, painful clotted periods. Sometimes they have endometriosis or fibroids or things like that. But sometimes it's more just PMS. Sometimes it's just that stress affects their hormones. And, on cycles where they're very stressed, you see irregular menses and that kind of thing. And we actually wanted to give them the opposite advice to the dry type. We wanted to teach these people how to get their estrogen levels down a little bit in relation to progesterone and their progesterone up. And then the last type, we call the waterlogged type because they're damp in Chinese medicine. And these are a bit like the tired type, but they have fluid metabolism issues, swelling, edema. But more importantly, from a reproductive perspective, they often have polycystic ovarian syndrome. And so they're sensitive to sugar. They have metabolic issues. They put on unfair weight, is what I call it. And we all know what fair weight is, but unfair weight is where you eat the same as everybody else and you put on weight, which is not fair. And we wanted to give them a program that was damp clearing. So we created a separate 3-month program for each of the 5 types. We still put people through that program at Yinova. It works really well. And on bad days or difficult days, I sometimes go to Amazon and read what are now hundreds of reviews of Making Babies, because it's been out since 2009, where people say, I did what they said in the book and I got pregnant, which is honestly, I can't even tell you how gratifying that is. Writing a book is like a huge operation. It's really hard work and you never really get paid for the work you put in, but you do get paid in satisfaction when you see that book work for people and you realize that your reach, which, my reach is just how many patients I can see in a day, suddenly becomes everybody who, just buys the book or gets it from their library, or even just goes on Yinova and reads about for free about what they can do for their type. So Sammy and I's message was, with some careful advice that is more targeted to you rather than just a one-size-fits-all, and some good diagnosis. Most people can get pregnant, and if they need assisted reproductive techniques, having gone through this process, they're more likely to work, because healthy people respond better to IVF usually. And that was borne out years later. There was some research by a researcher who is actually a friend of mine. Her name is Dr. Lee Hollander. She's a PhD practitioner of Chinese medicine on the West Coast. And she did a meta-analysis where she looked at thousands of couples who had been through IVF and split them into 3 groups. And one group had no acupuncture at all. One group had acupuncture just around the transfer of their IVF. So as they did embryo transfer, they had a treatment before and after. And one group did what's called whole systems Chinese medicine, which is everything that people like us at Yinova offer: dietary advice, lifestyle advice, moxa, Chinese herbs, acupuncture, massage. And those people had whole systems Chinese medicine for 3 months before their IVF, and they had a much higher live birth rate. It was actually really striking. And that sort of bore out what Sammy and I said when we created a 3-month program. Is it takes 3 months usually to turn someone's reproductive system around, 3 cycles. We weren't promising that everybody would be pregnant in 3 months, which I think some people thought, but we weren't. But we were saying a lot of people would be, and the people who weren't would go on to do IVF or get pregnant shortly after in a much better position. And that research that Lee produced sort of bore that out, although it came much later than when we wrote the book. And Emma, when she does her wrap up of this, will send you the link to that research because it's interesting. And I think that's enough from me. I think I should answer questions now. Emma, how would you like to do that? I know you gathered a lot of questions ahead of time.
Yes, thank you. First of all, thank you for going through all of that so quickly and succinctly, yet also in a lot of detail. That was super helpful. And listening to you, I feel like I saw another question, so I don't think I'm alone in this, but it's that I feel like I might be 2 types.
Yes.
I think that listening to you, I feel like I might be the pale type and the stuck type.
You are, and I know this because I work with you, because I know you.
That might be a good question to start with.
Yes.
It sounds like it is possible to be 2 types.
It is. And in the book, what we say is you will be a predominant type and you should follow the program for the predominant type, but take a look at the program for the other type too and see what you can incorporate. The most common thing to be both of is the tired, stuck type. People with kidney yang deficiency and liver qi stagnation in Chinese medicine. Those people run metabolically cold. They have naturally lower levels of progesterone, so they end up with higher levels of estrogen. And so they have a lot of the symptoms of estrogen dominance, including PMS, breast tenderness premenstrually is a classic sign, really, painful periods, that kind of thing. And sometimes what I do with those people is I actually treat both sides of that, and I give them a herbal formula in the morning and a different herbal formula at night. So we have some formulas at Yinova for the fertility types. If you're a Yinova patient, you have us and we will prescribe you a tailored formula, but we have formulas over the counter for each of the types that and they're good formulas. They're really helpful. And so if you're a stuck tired type, you can actually take the tired formula in the morning so that you have some energy for the day, and the stuck formula at night so you can wind down and go to sleep. And you could do that all the way through your cycle, and that's one way of handling it. Thank you, Emma. That was a good question.
Yes. So we have a few questions about ovulation. So I wondered if we could go through some of those.
Yes.
So one person was wondering if is there a specific day for ovulation? And how do you know it's all together? So, and how do you know when you're most fertile? Is that in the 2 to 3 days leading up to ovulation, or is there a different time that you're the most fertile?
Yes, there's a lot of confusion about this. And the reason is because I think we get taught that day 14 is ovulation day. But in fact, you can ovulate all over the place. It's usually 14 days before your next period, which is not very helpful unless you're consistent, actually, because how would you know when 14 days before your next period is? But egg white mucus, I think, is one of the easiest signs to look for. So we should start there. There's obviously, we'll talk about ovulation predictor kits too, and taking your temperature, but let's start with egg white cervical mucus, because I promise you more people have got pregnant at Yinova because we have told them, when you see egg white cervical mucus, have sex than anything else. So, oh, Millie, I will answer your question about what happens when you don't have cervical mucus in a moment, because that's a really good question. That's why I wanted to leave so much time for questions, everyone, because you guys have really good questions. So here's how to sort of gauge. This is cervical mucus 101, okay? So after your period, there's a sort of dry few days where you really do vaginally feel drier. And then you become more and more lubricated, and it becomes a little sticky to start with. And you might not see that because it may be so sticky it's stuck. And then it becomes creamy, a bit like hand lotion. And then it becomes, and if you're wearing dark underwear, that would be the kind of discharge that makes a rectangular shape, because it doesn't have as much water content. And people know that retrospectively when you say that. They go, oh yeah, I remember, I've seen that. And then at ovulation, it becomes much more watery. So on dark underwear, you'd see a round circle at that point. And it looks a bit like egg white, and it's sticky and stretchy. If you did stretch it between your fingers, it would stretch. When we wrote Making Babies, Sammy wanted to say that it would stretch 2 inches. And I took it out because I deal with fertility patients all day. And I was like, you know, people are going to be devastated if it only stretches 1.5 inches, or they're going to think they failed. But in fact, it's fine. It just needs to be stretchy. And so you get that cervical mucus for a consistent number of days a month, usually. So it's actually a very good gauge. Some people only get it 1 day a month, but the most common is to get it about 3 days a month. And if you always get it 3 days a month, when you see it, you know that the last day will be in, 2 days. Your most fertile day every month is pretty much always your last day of cervical mucus, egg white cervical mucus. So that is a good gauge. And when you see that, you're going to ovulate quite soon after that. And the time to have sex is just before you ovulate. You need to get the troops there ahead of the egg. So if you're doing a P-stick, a ovulation predictor kit, that's measuring LH, luteinizing hormone, which your body releases 24 to 48 hours after ovulation. So those are really useful because you pee on the stick, you get a positive, and then you know you're going to ovulate within 24 to 48 hours. So if you have sex that night and the night after, you've pretty much covered it. So that, I think, is cervical mucus 101. If you do BBT charts, which we encourage you to do because we get a ton of information from a BBT chart, not a basal body temperature chart is what that means. So I'm aware there's a lot of jargon. If I say anything that you don't understand, just flag it and I'll go back, because the jargon has become my life now. And I've forgotten that not everybody knows what a BBT chart is. We sometimes ask you to take your temperature every morning, your basal body temperature, with a special basal body temperature thermometer. They're quite cheap, and to chart it, because we can tell from that a great deal about what's happening during your ovulation, during your cycle. But it can also help pinpoint ovulation. When people have the LH surge, their temperatures tend to go down, not always, but they do tend to. And then immediately after ovulation, they go right up as your progesterone goes up. And if it goes up slowly, we give you herbs to make your progesterone go up quicker. There's a lot we can do when we see those BBT charts. So that is really how to assess ovulation. And most people, I think, pee on sticks. And although sometimes they can be confusing too, but I would encourage you to get to know your cervical mucus, because it's a really, really reliable guide to when you're going to ovulate. Now, Millie asked something about cervical mucus and not having it or sometimes having it. Yes. Well, flag it to us because we would like to give you herbs. We usually give you yin tonics in the follicular phase, before your ovulation. That period of time is called the follicular phase, and we give you yin tonics. I would also suggest taking an essential fatty acid. If you don't have cervical mucus. And if you don't have cervical mucus, it isn't the end of the world, but you have to think we have to get the sperm to get to the egg. And one of the things that, so cervical mucus is extraordinary stuff. It's the same pH as semen. It's the only time we produce as women fluid that is the same pH as semen, which is, you know, extraordinarily well planned. And if you practice women's medicine, you end up just being in awe of how intelligent bodies are and how much synchronization and coordination they require, and what that is a form of consciousness. And that is what we call qi in Chinese medicine. That is the world we live in as practitioners of Chinese medicine, is prompting the body to make those intelligent decisions and be aware in that way. And so if you don't have cervical mucus, one thing you can do is, and we sell it at the Yinova shop, I think, is you can buy a fertility friendly lube and use that, because it has exactly the same effect as cervical mucus. Cervical mucus has nutrition in, so the sperm can live for longer. And think about this, we produce this. This is amazing. And it has little striations in so that the sperm can swim, and they can live quite a long time in cervical mucus. It's actually why very young people, like college students, often get pregnant accidentally, is because they produce a lot of cervical mucus for many days, like 7 days often at that age. And the sperm can live all that time, which increases their fertile window by quite a long time. And so we've talked a lot about cervical mucus, but Millie, if you have no cervical mucus 1 month, get some of the fertility friendly lube and use that, but also flag it to us so that we can work on the root too, and get you producing your own.
Thank you. We have just a few more questions on cervical mucus, and I figure we can go through them quickly now and then move on. I see some other questions about timing herbs with ART cycles and so on.
Yes.
So we'll get to herbs and more of the types shortly. So someone was wondering, this cycle, I seem to have a lot of cervical mucus on many days, for example, like 10 days consistently. What should they make of that?
Oh, that is interesting. Yes. Sometimes, I mean, people who are very young and very fertile have a lot of cervical mucus. Sometimes as we get older and we get a little bit perimenopausal, don't panic, this doesn't mean you can't get pregnant. We get a little surgy. And we always think that as we head towards menopause, that we just get lower and lower estrogen until we don't get any more estrogen. But that isn't how it works at all. We often spend a decade just being slightly out of balance, and our estrogen is just a tad surgy. And I suspect that might be what's going on. I don't know anything about you, so you might just be the age of a college student and have 10 days worth of cervical mucus. But when I see that, I often think that people are a little surgy in their estrogen, and that the estrogen progesterone balance is a little off. And what I do usually is I put them on a different herbal formula for the first half of their cycle than the second half of their cycle. And I try and get that under control. And I like to set goals in practice. And so we would look for you to have a sort of contained 4 days of good egg white cervical mucus. You know, the other question I get asked a lot that I'm just going to answer, Emma, because it crops up, is people often ask me, and it's a really good question, how can you tell when you're trying to have a baby and you're having sex around ovulation, how can you tell the difference between semen and cervical mucus? I think it's actually a really good question. And the answer to it is that the cervical mucus is the stretchy stuff and semen doesn't stretch. And so that is the way to tell. Because I'm aware it gets a little confusing.
That's a great question.
I'm now answering questions people aren't asking, Emma.
That's great too. So we have a question from someone about bacterial vaginosis, and we also received another question prior to this. So I'll read this one out, and I told you about the other one beforehand. So, but anyway, so they said, I just found out that I have a BV infection. Can this affect my ability to conceive? And do you recommend treating it with antibiotics? And then additionally, someone else, and I don't know if this is the same person, but they had been experiencing repeat BV infections, and they're wondering if that could affect their fertility as well.
Yes, I'm sorry that you're dealing with this. When I was writing Making Babies, Michelle is saying she's not a college student, although she likes to pretend that she is, and it makes sense about the estrogen. Good, Michelle, I'm glad that resonated with you. When we were writing Making Babies, one of the things that Sammy said to me one day is, do you know what my favorite fertility drug is? And I just thought it was funny that he had a favorite fertility drug, but I guess REs do. I have favorite herbs, that's fair. And I said, well, what? And he said antibiotics. And I was like, yes, I get that. Because a lot of unexplained infertility, or a lot is possibly exaggerating, a proportion of unexplained infertility is actually to do with occult infections. Ureaplasma is quite a notorious one. I remember Sammy telling me you can get ureaplasma through your eye. It's not necessarily a sexually transmitted infection, but it causes implantation issues in the uterus, and you have to think these infections your body mounts a defense against, and so you end up with inflammation in your uterus, which is creates an environment. It doesn't necessarily stop you from getting pregnant, but it makes it harder. It'll slow you down. So actually I do usually recommend that people take antibiotics for this, and I've seen that work. I'm a very pragmatic practitioner. I just want to help people get pregnant, and so I'm not really dogmatic about doing it naturally or necessarily. I want to help people, and I do think that antibiotics work. So it's true for BV too. Your body is mounting a defense against the BV that it makes it harder for implantation. So I do think it's worth doing antibiotics. However, if you're getting repeated infections, one of the ways that we can help you is to make you less hospitable. It's one thing to kill the infection. It's another thing to make sure that you're less hospitable to getting it back. And that's about vaginal flora, and it's about inflammation and things like that. So we can give you a herbal formula that'll help your immune system modulate. We can give you probiotics specifically for vaginal flora and that kind of thing. And we can all work together to make sure that you're not just getting it again and again, because actually we don't want you having to take antibiotics over and over again, because then of course you are upsetting your vaginal flora too. It's a sort of delicate balance. So let us help you get to the root there, as well as treat the branch. But yes, the short answer, which I'm aware this wasn't, but the short answer is I'm a believer in antibiotics for these things. And Dr. David, who I wrote Making Babies with, thought that they were his favorite fertility drug for that reason. Often missed, actually, occult infections.
Thank you. That was helpful. So we had some questions about the herbs themselves, and someone was wondering if it's safe to take an herbal formula either whilst doing IVF or during the 2-week wait period. I wondered what your thoughts were.
I tend not to, for the most part. The reason is that the doctor is attempting to assess how much drugs to give you during the stimulation phase. We'll talk about the 2-week wait in a minute, based on your response to blood tests. And if I'm giving you something that they don't necessarily completely understand, then it's like making them do their job with one arm tied behind their back. And I'd rather make their job easier rather than harder, for their sake and yours. So I tend to do most of my herbal work in the run-up. remembering that study we talked about whole systems Chinese medicine in the 3 months before an IVF and how much that affected live birth rates. That's an important thing, is to get you into good shape ahead of time. So I don't usually give herbs during the stimulation phase. The reason I say usually is that we do have people who've had a very low response to follicle stimulating drugs in the past, and I might then give herbs, but if I did, I would talk to the doctor. Like, we'd all be on the same page. But there are herbs that we can use to help with that response, and there are cases in which I do that, and I've done this a long time in New York, so I know most of the fertility doctors, and I usually just call them and ask if they would like me to help in that way, and mostly people, doctors say yes. So that's that. In the 2-week wait, I often don't give herbs, and the reason I don't is that they're not necessarily particularly helpful, to be honest. What's happening in your body, apart from progesterone levels, is not necessary, and they're dealing with those in the 2-week wait of an IVF, is not necessarily affecting the embryo that much. There's a little bit of disconnect at this point, and the embryo is burrowing in. So, anti-miscarriage herbs, the sort of herbs I give people in early pregnancy, aren't really indicated at this point. They're handling your progesterone levels, which is the most important thing they can do, and something I could do with herbs, but they can do better by giving you progesterone injections because it's more consistent. So I tend to give herbs before the IVF and not during.
Thank you. Someone else was wondering if steroids in certain medicines can impact fertility, and if you think that they should be avoided, or are there alternatives or things you can do to balance that out if there is a negative effect?
Just steroids.
Yeah.
Yeah. Well, sometimes steroids are given around fertility treatments, and they're given to reduce inflammation, actually, which, as we just said, can affect implantation. They're also given to reduce uterine spasm right after transfer, although acupuncture does that really well as well. So I'm not sort of anti-steroids, but if you're taking steroids for a long period of time, and you need them, then we would love to see you in the run-up and try and offset some of the side effects of that on you, and just working with people and their health issues and their medications in order to help them get pregnant is our job. This is what we do, and we enjoy doing it. So we would look at you and see what effect the steroids had on you. And some people are more robust when it comes to taking steroids than others. Some people really struggle, actually. But in Chinese medicine, we see long-term steroid use as depleting the kidneys, which have a relationship with the reproductive system. So we would give you kidney tonics before you did an IVF to offset that. That would be our way of handling that.
Thank you. We had an interesting question about using just herbs instead of acupuncture. So I'll read it out. So they said, I understand acupuncture is a very important tool in the Making Babies program. I don't feel safe seeing an acupuncturist during the pandemic, which is totally fair. I live in Brazil, where the situation is really bad and only worsening. Are there treatments that can be done just using herbs? Or I guess, could you go over some of the tools that people can use also, herbs and at home, and nutrition and lifestyle advice, and are there things that can be done outside of acupuncture?
Yes, there's lots you can do. And I'm sorry, I know that things are really bad in Brazil, and you have our sympathy and empathy from New York, where we had a really rough time at the beginning of the pandemic. So yes, there's much you can do at home though, and we can help you. The first thing is, you might want to do the 3-month program from Making Babies for your type. You can take the quiz on yinovacenter.com and work out your type, and then follow the program in the book. And we can send you herbs. You can either buy the over-the-counter herbs for your fertility type from Yinova, or you can have a virtual consult with us, and we'll do something more tailored. And all of that is really helpful, including sort of dietary stuff. And a lot of my patients, we were really suffering with the pandemic at the beginning of this in New York, and we all went home for 3 months. And a lot of my patients took this as a really good time to work on having a baby, because they had more time to work on themselves. And so we I took tons of people in those early days through a 3-month program, just with virtual consults with me, and I taught them acupressure points and self-massage. There are self-massage exercises in Making Babies, so you don't have to see me to get them. And I have to tell you that all of those people are now pregnant. Not all of them did it naturally. Some of them, as we came out of the pandemic, went off to do IVF. But I kept notes of all these people because I hadn't been practicing for a while. I'd been taking care of the Yinova team. And so I came back because we had a pandemic to see patients. I'm still seeing patients because I realized how much I love helping people get pregnant. And so I kept notes to see how effective it was, and it was very effective. So acupuncture is really helpful to fertility, but if you are stuck at home, you have time to do self-massage and work out ways to relieve your stress. You have time to do the kind of exercise that supports you rather than depletes you. And there's much you can do, and we can send you herbs. So to Brazil. So and eventually you will emerge from this pandemic, and we're sorry that you're dealing with it, because I know it's intense in Brazil at the moment.
Thank you. Let's see, where should we go next? I guess on the flip side, so for people who are going to try and incorporate acupuncture and massage, do you have advice on timing acupuncture and massage, or are there certain times during the cycle where one would be better to use than the other?
We like to see our acupuncture patients once a week in the run-up to IVF, and then twice a week during the stim drug phase. And we like to time one of those before the retrieval and one after, in between retrieval and transfer. And then again, we like to see people the day after transfer, and that's how we do it with acupuncture. And the reason that acupuncture works is that it reduces inflammation. We've talked about inflammation quite a bit tonight, but you can use thermal imaging to show how acupuncture reduces inflammation. And it's somewhat counterintuitive that sticking a sharp, tiny needle, they're very hair-like, they don't hurt, for those of you who haven't had acupuncture, reduces inflammation, but it does because it increases circulation. And so the more circulation you have, the more debris gets moved out of the way. Increasing circulation is also important to resourcing a healthy egg and a healthy ovarian follicle that's holding the egg, and also to developing a really good uterine lining. And we also use the acupuncture for hormone imbalance and for offsetting the effects of stress on hormones, and also to stop uterine spasm after transfer, which it seems to be particularly good at doing. You can imagine that transfer is an unusual thing for your uterus to experience, and it sort of spasms in response to it. And that's why the doctors give steroids around transfer, but acupuncture is great at getting your body to relax. So that's how we use acupuncture. Massage, we do a specific reproductive massage at Yinova that we have developed over many years. You may have heard of Maya massage, which is a form of reproductive massage. Ours is more based on Chinese medicine and involves some acupressure as well. I think it's useful in the run-up. I think acupuncture is more useful as you go through an IVF. It's more focused. But in the run-up, it has the benefit of being deeply relaxing. Acupuncture is relaxing too, because you get an endorphin release. But massage just frees up all of that tension and stagnation in your fascia and in your muscles and your ligaments, which isn't just a problem because you feel like a turtle with a shell on and your shoulders up by your ears by the end of the day, which we all get like. It also stops flow. You know, we talked about earlier, I talked about how your body is so smart at synchronizing and coordinating, and it requires a combination of awareness, yin in Chinese philosophy, and the ability to act, yang in Chinese philosophy. And that endless interplay is what we call qi. You know, qi sounds like such an esoteric concept, but what it really is it's your body's ability to behave intelligently by being receptive enough to know where it is in the process and active enough to act on a prompt. And if your muscles are really tight, that communication becomes less fluid. You know, if we're seeing you once a week, we'd love to see you for acupuncture. If your budget, and massage as well as acupuncture, if your budget will allow it, it would be great if you came in for massage and acupuncture. If it wouldn't, then I would prioritize the acupuncture and come in for massage once a month. And just free up that fascia so your body's ability to communicate internally isn't impeded by lots of spasm and stagnation.
Thank you. And then for people who aren't going through ART, would the advice be similar? Or, I mean, obviously not totally.
Yes, we'd like to see you once a week for acupuncture. You could make one of those a massage. Less intense. So you could come in and have 3 weeks of acupuncture, and then say your period week would be a really good week to do that. You could have massage, which is sort of gentler anyway during your period week, and that would be a good plan.
Thank you. We had a few menstruation questions, so I thought I would bunch those together.
Yes.
Someone just wondered your advice on sanitary napkins. So they've been finding that they feel like they're allergic to the sanitary napkins that they've been using, and wondered about your advice on other brands, or if there's any that are better than others. They've been switching, but they just keep experiencing irritation. And before, or while you think of an answer, I'm sure you have ideas too, but I don't know if this is helpful, but I've started using period panties and I find those really helpful. I don't know if this person has tried that, but there are some brands out there that I can send some links. There's one that's not as expensive as the other ones.
I agree about the period panties. Actually, Think were the first ones, weren't they? I got some free in a swag bag, and I was kind of blown away by how good they were, because they don't sound like they're going to be like, you don't sound like you're going to be secure. Cotton is one of the most sprayed crops in the world. And then because of consumer demand and because of the way we've been cultured, they bleach it to make it white. And that is the problem for lots of people, that they're allergic to that. I think, do we sell organic?
So we don't sell them, but we offer them to people in the clinic. So we like the brand Lola. It's a nice brand, that we don't sell it.
That's it. I've seen them around the office. If someone needs a tampon or a sanitary napkin in our office, we do have them, obviously. And we use Lola because they're organic. And so I think the thing to do is to find some natural ones, and not expect your sanitary napkin to be an abnormal color of white because they bleached it. That's how they've done that. And it's possibly the bleach you're reacting to, or the sort of non-organic cotton. I actually think, vaginal tissue is very permeable. And it is one of those things that I think is really important, is that we shouldn't be putting a sort of very chemically treated tampon in there and using them for 1 week a month. There is some leaching going on. And we can't afford to do everything organic, any of us, but this actually might be a worthwhile investment. And one of the things I've noticed is that natural sanitary napkins and tampons have really come on in the last few years. I used to have to buy them online, and I was the only person I knew who did this, and everybody thought I was weird. I wrote, there's an article on the Yinova blog, isn't there, Emma, about this, because I wrote about it because I thought it was so important. And I've noticed in the last few years that there are lots of companies doing it, and of course because of that the prices come down. So Lola is what we use at Yinova.
Thank you. Someone was wondering, there's a question about, actually, there's a few questions about people who have male partners. So one person was wondering, I'll just read out the question the way that it was written. So they wondered what your thoughts were on men getting tested for fertility. So they said that their partner thinks that they're fine because he's younger, but they're struggling to get pregnant. Do you think it's a good idea for both of them to get their hormones tested and to get fertility tests?
I do. And I'll tell you why. Men have their reproductive status can change quite a lot. Now, men tend to believe that if they've ever got anyone pregnant ever, then they're fertile, like it's very static, but that, or if they're young, in fact, but it can go up and down quite a lot. And they may, but the good news is it can change for the better really quickly too. They make new sperm every day that come into fruition in 72 days. So in 3 to 6 months, they can really change their reproductive picture. And so it's really worth doing some testing, doing a semen analysis. They don't like to do it, which I really understand instead, because I wouldn't like to do that either, but it is, we get a lot of information from it, and it's not like it's useless information. There's much we can do to help, and they can really change their picture. We treat men at Yinova for fertility issues, and we give herbs for all the kind of issues that men have. When they do a semen analysis, it's not just that they're looking at how many sperm they have, but they're looking at morphology, which is the shape, and they're looking at motility, which is how they swim. And they look at 2 different types of motility. They look at how much endurance they have, and also how much sense of direction, because some of them have a lot of endurance but are just swimming around in circles, because isn't that life? And so and all those aspects of a semen analysis we can improve with herbs. And we can also, it's worth having a semen analysis if there's anything more serious. Doctors can take a look too. You could see a urologist. Some men have what's called a testicular varicocele, which is a little varicose vein in the testes that they may not be aware of. They may not be able to see it with, or feel it. But what it does is it heats the testicle up just a little bit, and that overheat because of the stagnant blood that isn't moving in the varicose vein. And over time, that leads to sperm that get damaged and a little bit misshapen. So I always think, this may be a bit of my type A personality, but I always think that it's worth having a semen analysis early so that we can multitask and solve both halves of a couple's problems at the same time. Because it is quite frustrating if we've been treating the woman and we've made her take herbs and she's had regular acupuncture, and we've got someone, we're like, yes, look, we've got a regular cycle, and then we find out that we need to treat the other partner, and it would just be, it's just more time effective if we do that all at the same time. So I am a big proponent of having a semen analysis sooner rather than later, and with the knowledge that you can, in fact, there's a ton men can do to change their reproductive status, and a lot of it's lifestyle-y, you know, just cutting back a bit of alcohol, eating a little bit better, cutting down on saturated fats, moving a bit more. There's plenty you can do, not overheating your testicles. So that means no laptops on knees, which is a thing and no hot baths and that kind of thing. Men who cycle a lot often have lower sperm counts because they're putting pressure on the testicles. So, you know, that these are all things we would find out from a semen analysis, and then we'd be able to troubleshoot with a combination of herbs, possibly medical treatment, and also just sort of lifestyle and diet changes.
Thank you. I just want to take a brief moment. I know we only have about 10 minutes left. I've made note of there's a lot of questions that we're just not going to be able to get to, but I'm making note and I'm going to try my best to find answers either between Jill or the other practitioners and send them all in the recap. So we'll try and get to everything. But these have all been really great questions. So thank you for sending them in. We had a question about diet. And I wanted to just touch on nutrition a little bit. So they said, my body fat is a bit higher than 25%, and I've read that it can hinder fertility, or it can hinder fertility rather. What are your thoughts on body fat in relation to fertility?
Yes. If you are overweight, you don't have to be, you know, skinny to get pregnant at all, but it's often worth just losing a few pounds, and it really is often a few, you know, it's often just 5 or 6 pounds, and in some cases I've just seen people get pregnant really easy as they start to lose weight. It's almost like the starting to lose weight is helpful rather than, you know, getting anywhere. And that may be just the change of diet that requires. It is easier to there's a broad range of weights of which it's easier to get pregnant. And the biggest problems we have are with people who are underweight. Those people often have very irregular or no periods, and they just need to put on a few pounds. And people who are overweight, and not just slightly overweight, but are you know, definitely overweight. What happens is adipose tissue, fatty tissue, is estrogenic. It creates estrogen, and so they end up with a bit of estrogen dominance, which makes it a little harder for them to get pregnant. Now, we can treat that with herbs. And we would happily, but we might encourage you to lose a bit of weight and support you to do that. You won't find us lecturing at Yinova. You know, we come in all shapes and sizes as practitioners too, and so, but we will help you. There are ways we can help with hunger and a sort of clamoring stomach. There are ways we can help with sugar cravings, and there are ways we can help with metabolism. But we would like you not to have so much excess fatty tissue that it's actually producing estrogen and knocking off your estrogen progesterone balance. And that's really what we're talking about. I wanted to answer one of these questions because I didn't want someone to worry. Someone asked, if you see small clots, does that mean it's a miscarriage? And I just want you to know that that doesn't. Because that would be upsetting, and lots of people have clotted menses, and we use it to measure the efficacy of treatment, because we would like you to have a very smooth uterine lining that doesn't have sort of mucusy areas and things like that, and it speaks to some circulatory issues if you're having lots of clots, but it doesn't necessarily mean a miscarriage. It just means that your uterine lining, when it's shedding, is coming off in a sort of unsmooth way, so we'd like to smooth that out, but it doesn't mean that every time you see clots you're having a miscarriage, so don't worry. Basically, that's why I wanted to answer that, because I didn't want you to worry.
Thank you for catching that. I wanted to bring that one up too, and we had another question about miscarriage, so I will ask that one now. So this person experienced a miscarriage and are hoping to get pregnant. Is there a recommended amount of months of acupuncture they should plan for before trying again, or what do you think would be a good plan for moving forward?
Yeah, I'm sorry that you've been through that. I don't think people understand the pain of miscarriage until they go through it, or they're like us and hold people's hands while they go through it. But it is hard to deal with. And when it comes to how long to wait before you try again and things. I think we have to factor in age. And also your hormonal status, things like your FSH and your AMH, because some people have more time than others. And in a perfect world, we would love 3 cycles to get you back into shape after a miscarriage, but it's not always perfect. And, I have a patient at the moment who has quite high FSH, and I am attempting to turn her case around quickly so she can try again, because I don't know how much time she has, and I don't want her to spend it just having acupuncture and not trying. So it's difficult to advise you because I don't know your status, but I would say that the month after a miscarriage is always a weird month, and reproductively and emotionally, actually, but reproductively, it's a weird month. And the next month, if you have a completely normal cycle, then the month after that would be a good month to try. And that would be my aim. That's our aim at Yinova when you come to us as a patient after a miscarriage and you want to, just get back to trying to conceive, is we try and get your cycle as normal as possible so that it makes it easier next time around.
Thank you for answering that. We have a few more minutes. I'm going to try and squeeze as many as we can in that time. There were 2 themes that I noticed people asking questions on, so I'll try and just succinctly ask about those 2 different ones. So one is advice on people who are trying to conceive in their late 30s or 40s, both either naturally or through ART, and if you had any advice on approaching that.
Yes. And also, actually, there was a question about FSH for women in their 40s and what's a normal range. And the answer is that there is no complete normal, but FSH, the fertility clinics usually have somewhere around 12.4 is quite common as their cutoff for IVF. But fear not. People at Yinova have got pregnant with really quite high FSH. And I tell a story in Making Babies of a woman whose FSH she was in premature ovarian failure, and her FSH was over 100. And Sammy and I worked to get it down together. He gave us some estrogen, I gave her herbs, and it never got down to anywhere that would be considered normal, which is like 10-ish and below. But when it got down to about 35, I think it was 33. It's a long time ago, but this woman is forever on my mind because it was an extraordinary thing. She got pregnant, and she got pregnant naturally. Sammy and I were planning to catch it and get her in for an IUI. And in fact, she felt like having sex because bodies are amazing. When she was ovulating, and she got pregnant naturally, and she went on to have a very healthy baby. And her FSH had been 100, never went down to anything lower than 30. So what was the other question? Because that was the FSH part of the question, Emma, was just advice for women in their 40s.
Yeah, so I was more just trying to, the overall theme was there were a few people who were in their late 30s, early 40s who were either naturally or through ART.
Yeah. This is a lot of our patients at Yinova, actually. Being based in New York, people tend to have children a little later. And so this is a lot of our patients. And the good news is that many, the vast majority of them go on to get pregnant. But you have to work at it harder. And I always say that in your 20s, you could sort of abuse your body and still get pregnant, whether that's a good idea or not. You can't get away with that so much in your 40s. Things that you do. I do think there is hope, Millie. Indeed, I do. I've enjoyed meeting you through the chat here. That I do think there is hope as long as you're having regular periods. But there are several things you need to sort of get clear on. The first is that not every month is going to be a winner by any means. And not all of your eggs are going to be viable, which means that we do have to catch every month. So we have to get very good at catching ovulation, and we have to get everything else right. So we would ask you to, in our practice, to take a basal body temperature chart for us so that we could see what's going on all the way through your cycle, and we try and normalize everything. so that we have you ovulating on day 14 and your progesterone going straight up and sustaining and that kind of thing. So it becomes really important. Timing becomes really important, and diet and lifestyle, following the program for your type in making babies, is much more important. But it is possible, and we have lots of stories to tell about that. Someone's asking about the name of our reproductive massage at Yinova, and we designed our own. So it's the Yinova reproductive massage. But I know you're not in New York City, because you said, and if you find someone who does Mayan fertility massage, that would be really helpful, and that's much more common. There are often a few Mayan fertility massage. Oh, and Emma has put it in the chat for you. You'll be able to find a Mayan fertility massage expert, I think. And if not, this is not as much fun, but you can do the self massage in the book, which is based on Mayan fertility massage. And we got permission from the woman who designed Mayan fertility massage to put that in the book. So it's nicer to have that done for you, but you can do it for yourself, or train your partner to do it, which might be fun.
We also have our bodywork team are also able to reach patients virtually, and they can, again, to your point, it's not as much fun massaging yourself, but you could get your partner, if you have one, to do it, or invite your friend over and make them do it for you. But our team can also do virtual massage.
That's right. We have been doing virtual bodywork where they literally tell you what to do. And you could do that. Our massage team are lovely. They're very specialized and very good at what they do. So do feel free to take advantage of that, and we will help you.
Yeah, that was at the tip of my mind, because this evening we run a fertility coaching and support group every couple of months. And tonight's meeting is with Daryl, the head of our reproductive health bodywork program, who's going to teach everyone some virtual massage. So
yay. It's worth mentioning, you guys, that the fertility coaching and support group is so good. The first group of people who went through it loved each other so much that they continued to meet without us on Zoom, which I think is awesome. But it's not just a support group. It is a coaching group, which takes, I think it's 8 weeks, isn't it, Emma, to go through the whole Making Babies program for your type and answer all those questions. When is the next fertility support group?
So that's a great question. So the next scheduled one is in September, which is a while away. So we're in the process of trying to squeeze in another one in between then, maybe a summer one. So stay posted, stay tuned. We have, I see your name there. I'll try and find your email address to kind of reach out to you more directly about it.
Well, you know what you should do is just contact Emma. She's just emma@yinova.com, and make sure that you're on a list, because I would like to think that we put an extra support group in there. I think it's a lower cost way of getting this information, and I think it's really helpful. And they meet on Zoom. We keep the class small so that it's intimate and warm, and it's taught by two very experienced Yinova practitioners usually, and they do an awesome job. So if you write to Emma, she'll put you on a list for the next one.
Yeah, and I've had the I'm going to call it a privilege, because it's been amazing being able to listen to Anne is the one leading this group, and it's just been it really is, it's the coaching element and the support element, but it's really heavy emphasis on education and empowerment through education, and it's really amazing.
Yeah, and Anne and I have worked side by side for almost 15 years, and she is a phenomenal practitioner. She has so much wisdom to offer, and she's kind and warm and funny and sort of sassy and smart. It'll be a really, Anne Brunn is in charge. She's also a Yinova practitioner. She's fabulous to go to see for acupuncture, but she's leading that support group, and she's a joy.
Yeah, you can see Anne for individual treatments too.
Yeah.
She's
the best.
Very great. So we are over time. There's so many questions, and it's really hard to get to everything. Maybe we should do a part 2. I'll try my best, like I said, to email and like the little summary recap some answers to some of the other questions that we weren't able to get to. But thank you, Jill, so much for taking the time to answer all of these questions and for speaking with us today. It's been really nice to spend time with you.
Well, thank you, Emma, and all of you. It's actually been really fun to answer your questions. I love the Yinova community, and I love gathering in this way. And I will, if Emma gathers together some of those questions before she sends up the wrap-up email tomorrow, I'll try and answer some. I'm back to back with virtual patients tomorrow, which reminds me to tell you that you can actually still see me as a new patient. I'm still seeing new patients. I've had so much fun this year that I'm carrying on helping people get pregnant on Zoom.
That's exciting. It's the first time that you've seen new patients in how long?
10 years. I saw follow-up patients, but I stopped because I had a 9-month waiting list, and I didn't feel it was healthy for people to wait to see me for 9 months. I wanted them to get treatment really quickly. And so I used to just leverage my experience out over the team. But I came back and I have found a use for all of this weird knowledge that I have.
Doing that. It's really helpful and great.
All right, you guys. Well, my husband Noah is making me dinner, which is very nice. So rice and beans, not very exciting. He's listening. I shouldn't say that. It's going to be lovely, but I'm going to go and eat, but it's been really fun to hang out with you. You're welcome, Millie.
Well, thank you, everyone. This has been really nice. Thank you for joining us, and we'll reach out with more information shortly. Thank you, Jill, for
Bye,
spending.
you guys.
Bye.